Patient safety is always and should always be our number one concern. When we have an IV tubing here, many times or always, they have a Luer Lock attached here, a port, an IV port. So this would be the end that attaches to the patient. And then here we have a Luer Lock where we can actually take a syringe and push medications through or check the IV or whatever we need to do. So we could hook our syringe up here. But if the tubing is just waiting here to be used and continuously infusing medications to the patient, then this Luer Lock is exposed, and that's never a good thing. Yes, we have to be cautious about wiping the Luer Lock, prepping it appropriately before we administer any medication and or hook any syringe up to it. But the nifty tool I want to show you today is these little caps. So these are alcohol saturated caps for the Luer Locks, and they come in this nice 10 or 20 pack here, and they are really nicely pre-saturated. They come with a hook here, or with a hole that we can hook them on to the top of the IV pole and just have them readily accessible, so we can also remember to use them. Then you just peel them off, and if we take a look inside, it's just a little foam cushion that's saturated in alcohol. And then we can go ahead and just cap the Luer Lock with it, and now we know this lock is going to be kept sterile. Now clearly, if you go in to administer medication here, even though it's capped, generally you won't know how long the cap has been on there. So we want to take it off and then still go ahead and use our alcohol wipe and prepare the area according to our safety precautions, and then be able to administer the medication.